Hi, Dr. Patterson here again. And in one of the posts I made for Instagram was the 2024 goals that I set for the patients in my office. But every practitioner set goals. They go through their charts. They look at the things that the patients presented with, signs and symptoms, and the manner in which they treated them, how much success they had with it or not, and try to find ways in which to improve. And so we're going to embark on trying to get you to eliminate meat. In the Black community, when I first started, the goal was to get you to use more chicken and fish, which was a little bit better than pork and red meat. Now we want to eliminate all meat because there's so many contaminants in meat, and what we're seeing now is the effect over the last 70 to 80 years of contaminated food. And food, we won't get into the actual contaminations or contaminants of the food. That's for another video. But we do know that a lot of antibiotics, a lot of chemicals, the farming industry that for chicken, pork, cattle is not safe for consumption given the environment that they're in. And so these animals consume the feed. They also in crowded conditions. And so as a result, you have to use antibiotics for infections. You have to use growth hormones for the cattle, and not to mention the pig. The pig should only be used, or hogs should only be used for medicinal purposes, like what we see with the pancreas, the pork pancreas. Pork pancreas is good for any individual who has some form of cancer, where you can utilize the enzymes, and for the insulin. As a matter of fact, a lot of your insulin that's used, now they've changed it where they have other forms of insulin, but it used to be where your insulin came from pork pancreas. And so in that instance, the pig was used for medicinal purposes. You can also use cattle for grass-fed beef cattle for if you're on a carnivore diet. If you have certain types of cancers, they respond more to a red meat diet than fruits and vegetables. And so we'll talk about that when we talk about the central nervous system, or the autonomic nervous system, and the two parts that comprise it, and how diet affects those. So, but I want to look at this being Martin Luther King's birthday. I want to contribute my part. And I'm looking at the African American community because there's a lot of information. Some of it is accurate, some of it is not accurate information. So what we're looking at is the fact that you may have certain types of feelings toward medicine and healthcare. The bottom line is that you have to take care of yourself. And so in taking care of yourself, look at some of the science, not all of it. Don't wait on the science to prove things, as we know that certain things are treatable by alternative methods. So you need to take more responsibility. And so what we're doing is what we've always done. We're offering a program. Now, I'm going to talk to you about the 10-day Healthy Inflammation Response Program. I'm going to just read through the book. You're going to get a small book. When you get your supplements and go on the program, there's a small pamphlet. It's very easy reading. And it says on here, reshape your life in just 10 days, which you can do. So the important thing is to be able to follow directions. And that's what we found is a big problem for a lot of patients, is their inability to follow directions. I just wonder how you're able to cook if you can't follow a recipe, what the outcome of the what you're trying to cook is. So, but here, all we're doing, and this is for a lot of you patients who are unable to do a water fast. You don't have to start there. A lot of our patients over the last 41 years, they did not start with a water fast right away. We had a few, but most of them started with just a change in lifestyle. They may have stopped smoking or reduced smoking. They may have given up soda pop or reduced it. We had one patient who she drank a case and a half. I guess you call that a case, but it's a six-pack. Maybe you call it, it's a six-pack. 6 cans of soda, of Coca-Cola per day, and had headaches and wondered why. This was in the course, this is every day, 7 days a week. So what we did was just start reducing 1 can per day, you know, and we got it down to where it was a half of a 6 pack, 3 cans per week the first week. So we just kept reducing that 1 can per week, and by the end of the month, they was off of the Coca-Cola, and the side effects were minimum toward the end of the month. They were really bad during the very beginning, but they were heavy when we first started. So, but anyway, when we talk about this 10-day, and I got a illustration with the knee joint. I want to talk about that as soon as we go a little further into this. But you're going to go through your book. It's going to start with telling you about the guidelines that you should focus on in terms of unprocessed foods. Unprocessed foods are your fruit and your vegetables, lean protein. So you're not going on a meatless diet. We're going to improve the quality of the meat because we don't want to start cold turkey. The whole idea is to get you to wean yourself off of meat. Meat is a problem right now because we see a rise in colon cancer. The biggest problem with colon cancer is the fact that you eat or consume foods that have no fiber in it. Now, when you do that, you actually destroy the lining of the colon. When you destroy that mucus lining of the colon, your bacteria is not being fed. It's going to start to eat away at you. So we'll talk about that a little further later on, but I just want you to see that we're not trying to punish you. A lot of patients look at, a change in their diet as a punishment. It is not. It's to try to get you to improve your diet because 70% of all illnesses that you take medication for are preventable. And the death rate is ridiculous. And we saw where most of you eat so much food. And I always said you eat too much too often of the wrong food, especially around the holidays. Thanksgiving and Christmas, and then the alcohol consumption for New Year's actually kill a lot of patients during that period of time. And so you can see where the census is so high during that period of time after these holidays that we end up taking a different turn if a patient is already showing certain predisposition to certain diseases by which they're taking medication for, and now they just overdo it and they may succumb to it. So here in the book, it talks about what to avoid. You avoid your refined carbohydrates, artificial sweeteners, sugar, chemical additives, processed meats. You want to get rid of that, meats with the nitrites in it, processed meats, fried foods, caffeine, and soft drinks. So that seems like a lot. But I mean, you've had your fun already through the holidays where you consumed all this stuff. So we're going to just start to reduce it. Okay, and so you have a little help with where you can actually just stop these things here. This program comes with shakes with whole food ingredients. That's the important thing because you'll find that by the time you get 3 to 4 days into it, and you only have 10 to do, you won't have an appetite for these foods that you consume that's put excess weight on, elevated your blood pressure, your blood sugars, your insulin levels are off the chart, your cholesterol, your triglyceride, which is the fat in the blood, that's extremely high. You have excess weight. And the other question I have for you is, when you get on the scale, what weight are you measuring? You're measuring fat. There are 3 types of fat. Which fat are you measuring? The scale doesn't tell you that. 2 of the fats that you have that you might be putting in as part of what you call overweight or contributing to obesity are deadly. So the other one is something that you can tolerate, but you have to lose the excess part in order to get down to a normal weight, which is a lot more healthy for you, but it's not going to kill you. It's not going to present a problem, but there are 2 others of the 3 that are deadly. So then it goes on to tell you about getting ready. When you get ready to start your 10-day program, there's a couple of things you want to do. So you want to evaluate your kitchen. You want to remove any kind of high refined sugars, these type of foods, your fats, your carbohydrates. You want to stock your pantry with, we're talking about the refrigerator and pantry with protein. Now, these are meats that are like your salmon. There may be certain types of fish that you can have during this time as your preparation. So we don't want fried catfish. We want you to have baked or broiled fish. Okay, so your vegetables, your fruit, and so you want to get follow the book and follow these steps in here. It tells you what to do prior to getting started. You want to get more sleep. You will sleep, and that's very important. You want to eliminate coffee and alcohol. So the whole idea is to get you to not go cold turkey, and that's the reason why I have this knee here, because this is the one I've used for a lot of patients who were diagnosed with having knee problems and they needed a knee replacement. And so you can see this is the knee joint right here, this patella tendon in the front. The kneecap is right behind the tendon here. But you're going to have your lateral meniscus, and then you're going to have the medial meniscus right over here. These are the pads. They're like shock absorbers. These are the pads between the femur, and which is the thigh bone, okay? Then you have your tibia, your leg bone, and the fibula. And the fibula is a small bone. A lot of times patients fracture this, but all your muscles in your legs are attached. It's about 8 or 9 muscles that are attached to the fibula. You can break this here and not really, or fracture you, and not know that it's fractured other than some pain until you get an x-ray, depending on the type of fracture. But all your muscles are attached here. But going back to the knee joint, when we look at this joint right here, this padding is eroded away. So you're looking at the tibia and the femur and the tibia, and they're actually approximating one another. So this is missing. So what they call bone on bone is when the femur and the tibia bones actually articulate together. Now, I'm going to tell you something. And so what they're going to do is they got to go in and shave some of this down. They're going to put in a new joint right in here so that you'll be able to articulate. You'll be able to move about, flex and extend the leg, the knee, and so without any pain. The problem with that we found was that there are some patients who have bone on bone. You have the femur and the tibia touching one another, and they don't know it. They don't feel any pain. And so that brings to mind is a question as to, they don't know that they have a bone on bone situation until there's imaging done, meaning x-rays and or MRI. So, which brings to mind the question as to whether or not you really need the procedure. So there are other procedures where they can go in and fill this in, this joint space, with a gel. And then you can sort of grow some of this back. So you need to question your doctor and see if they're a little bit more conservative. If you don't have the pain, then you might want to go a conservative route for a while until you actually need surgery. But then what about the ones who need the surgery? Okay, this is totally eroded away. They have to have the surgery. So why do you need me? You need me because the surgery cannot be performed because of your weight. You're too obese, and the pressure, it presents a surgical problem and a problem during recovery. So what happens is that the doctor will give you a certain period of time. The orthopedic surgeon wants you to lose a certain amount of weight in order for them to administer this procedure, the surgical procedure. So this is where this program comes in. And what we found was that patients who went on the program, 10 days was not enough. And so they repeated this program. Some patients repeated the program 8 times. See, so you look at, we're looking at basically a good 3 months, 2.5 months, 3 months, 4 months before they got down to a weight that was presentable for going through with the surgery. So, and then what happened, another thing that happened was that we noticed that some of the patients no longer complained about knee pain. When they lost, say, 40 pounds, 20, 30, 40 pounds over a period of 3 to 4 months, they no longer had the pain in the knee, which they presented with in the first place with their orthopedic surgeon. So, you know, medications and supplements, they talk about that. And now, you know, years ago, when I tried to give patients supplements, a lot of your allopaths would take you off supplements because they didn't really understand the purpose, and they thought that they would interfere. So we had the patients separate the times. We knew that using whole food based supplements, if you're eating there's no reason why you should have any interference. But we did that to help the patient have some sort of peace of mind, but they were still getting whole food supplements in with their diet. So we talk about food. Water is going to be very important. You got to refrain from processed foods, your soda. Diet soda is worse than the regular sodas. Fruit juices, energy or sports drinks, alcohol, coffee, non-herbal teas, and caffeinated drinks. Get rid of processed meats. No sausages, canned meat, cold cuts, hot dogs. You can't have any of that stuff. Now, that's not a tall order. When we consider that you are eating some food, just eating a better grade of food, better quality of food, and you are still eating something, you're getting calories in. Unlike a person who is on a water fast, the most they'll get in is about 400 calories if they're on lemon, honey, and water. And if you use all water fast, it's less than that. So you need, you'll lose a pound a day with a water fast just with 400 calories or less. But they can survive that for 3, 4, 5 weeks. Okay, so now the book is going to show you some information, regarding the supplements that you'll be taking. You're going to have the protein powder, that contains fiber, your calcium support for the immune system, your the intestine, and your muscular and joint and bone health. So you're going to be given a blood cleanser. We want to remove toxins that are embedded or circulate in the blood. You'd be given an anti-inflammatory, your turmeric supplements. And these are some very strong, powerful supplements because they're food-based and they're condensed. One of the supplements is called Cerulita Plus. Cerulita Plus supports the capillaries, is good for peripheral circulation. Now, this is something I've always given patients who were recovering from a stroke. Now, if you had high blood pressure and it was deemed or suggested to you by your PCP that if you don't get the pressure down, you run the risk. Your risk for a stroke is very high. We use that Cerulita Plus. And so a lot of patients who have strokes, in many cases, have small capillaries these small blood vessels that contain some parts of, tissue that makes up a clot that's broken off. And this is what causes strokes. So you got to be very, very careful about that pulmonary embolus. The Cerulita Plus actually thins out the blood. It's not just trying to reduce the clot, but it thins the blood out. So if you're not on a blood thinner, this is one of the ones that you want to take. So it's going to thin your blood out. It's good for your circulation. And then you're going to have something that's going to help repair the tissue. So you got food-based whole food supplements. It tells you how to take it. You're going to use the shakes. The shakes are very important. You're going to take your supplements. It gives you how many to take in terms of frequency, how many, the number of times per day, the number of shakes to take. The purpose of the shake is to act as a a meal replacement. So, but the thing about it is loaded with vitamins and minerals that you should be getting from your food. Now, you're not getting those vitamins and minerals from the typical diet of ham, bacon, eggs, toast, butter, grits. You're not getting that. See, and that's why we're going to talk about the difference between fortified and I'm just looking through this here to see how they break it down. But we're going to talk about how they fortify food to help make it more nutritious, because you like a certain type of food, but the food is definitely not nutritious. And if you ate food that was really nutritious, most of the food that's good for you have a better taste to it. So that's the reason why you like sugar. But you be careful because your tongue has is designed whereby it's able to become adjusted to that taste of the sugar. So you'll find that your taste buds will increase in terms of being able to give you that, desire or want for more sugar. So that's why you increase your sugar, because you have an adjustment with your taste buds where they they get used to it. They become immune to the fact that, we had half a teaspoon of sugar, and now we want 3/4 of a teaspoon. Then you want a whole teaspoon. Next thing you know, you're eating a tablespoon of sugar. So that's where a lot of your weight comes. So you got your water and your tea. That's important during this period of time. You got your shake, 2 to 3 per day. And then you got 60% of this. They give you a breakdown as to what your plate should look like. 30% protein, 5% miscellaneous, 5% nuts and seeds, and 60% vegetables. Not a lot of fruit. So you don't have the sugar from fruit because the fruit contains sugar. Even organic fruit contains sugar, but that sugar does not cause the addictions that you would see. So the 10-day program food list, they have a lot of vegetables in here. Okay, I'm looking at artichokes, asparagus, avocados, bamboo shoots. You can make a salad out of most of this stuff. Beets, bell peppers, broccoli, Brussels sprouts, cabbage, green onions, green leafy vegetables, from the beet tops, greens, bok choy. Bok choy is excellent. Your chard, your chicory root. Chicory root is good for fiber. As a matter of fact, if you use chicory, chicory is good for the prebiotics. See, and so if you want to get your prebiotics in, one of the ones that you use is the chicory. Your mushrooms, the leeks, kale, okra. There's a variety. So they give you a list. Then they give you, those are your green vegetables. Then you get your starchy vegetables like your lentils, your plantains, your pumpkins, sweet potatoes. So you got a variety of foods that you can eat. And then when it comes to the fruit, you have your apples, berries, cherries, your grapes, papayas, and peaches, pears and plums, and the average is about a half a cup to 3/4 of a cup per day. So you have that while you're on it. So the thing that you're interested most in, I think, is the meat. So we're looking at chicken, turkey, duck. They do give you that option. Lean red meat, your meat, your beef, venison, buffalo, salmon. Now, the red meat should be grass-fed. Okay, so that's what you want with that. Sea bass, cod, tuna. So these are the meats that you eat. Now, you have a choice of butter. Your dressing should be cider vinegar. And you drink spring water while you're on this. So when you do this here, you have a journal. They're going to have you fill out breakfast, lunch, and dinner, what you consumed. Did you take your supplements? How you felt today. You have a little sad face, mum face. You have a happy smile. What exercise you do? And the best exercise I recommend that you do is walking. Okay, and so when you walk, is the best exercise for your cardiovascular system. You have to be able to determine the amount of walking, move this out of the way, the amount of time that you need to walk, the distance. That's important. Don't overdo it. And that's the whole purpose of a 10-day inflammation response program. When you do this, it's going to take out the inflammation. So that's what the purpose of the supplements do. It gives you the nutrition so that you don't go cold turkey, that you have reactions. A lot of patients will complain about the fatigue that they may suffer. They complain about constipation, insomnia, headaches. These are things that you complain about, but they're side effects of your body's colon being impacted with waste matter. And what's happening is that you reduce the amount of calories that are coming into the body. That's less calories in the bloodstream. But the toxins that are already embedded into these 3 areas of fat that I was telling you about, they start to dump. And you start to break down some of these toxins through a reduction in fat. So it's a process that your body will go through to remove the fat molecules. In those fat molecules are heavy metals. They're in your skin, they're in your fat, they're some of the residue from the medication that you're taking, the chemicals that you're exposed to through touch, through toxic exposure, where you may have gloves on, but you may not have a mask on. You may get exposure that way. There are parasites. If you eat meat, there are parasites in everything that we consume. Basically, you just can't see them. And so you feel that. That's why you get these symptoms. So you also have the fiber on this program. The fiber helps you to eliminate a lot better, a little faster. And then we have some things that the patients who come in to do in order to accelerate the removal of this. Now, this is a program that you don't have to become a patient. You can just get the order the program and do it at home yourself. We'll follow up after the first purchase of the program. You call, you order it. It's best to have the consultation, because usually during the consultation we find out more about you, and the patients, they end up becoming patients. But you don't have to. But this is something that you can do. It's a stay-at-home program. You can do it yourself. Just follow the programs, and if you need to repeat it, just order some more. So it's called a 10-day healthy inflammation response program. It'll reshape your body. And what better time to do it than in the wintertime? And this area here is very cold. You've come off these holidays. You want to reduce your risk of chronic diseases. The chronic diseases are all caused by food. They will not respond to drugs. Drugs will never eradicate the chronic illnesses. I don't care what's being told to you or what you've read. You have to treat diseases that are caused by consuming foods that are ill prepared, or foods that have a source of contamination, foods that are going to alter your metabolism in the body. You have to treat that with a food, good food, whole food, and the body will repair itself. The body cannot repair itself or restore itself to homeostasis if you continue to put bad fuel in. So what you want to do is give this some thought. This is an explanation of the program that I had put on the Instagram, talking about the 10-day healthy inflammation response program, and just give it some thought. It might be something that you want to do. You can call. I'll put a link in, the number that you can call to get more information in terms of cost, shipping, that sort of thing. Decide whether or not you want to just take the program and do the stay-at-home program yourself, if you want a consultation or not. Most of our patients, they started the water fast by starting a program like this here. If you have problems with your knees and you've been told to lose weight, this is the best program and best way that you can do it. Okay, until next time, best in health.